President Obama just signed the 21st Century Cures Act, one of the most sweeping efforts to provide additional programs and funding for health and innovation in America. The $6.3 billion bill is a complex grab bag of initiatives amounting to nearly 1,000 pages. It takes on several things like opioid addiction, medical devices, access to new drugs, and something close to the president and vice president's heart: cancer.
So we're tackling cancer, brain disease, substance use disorders, and more. And none of this work would have been possible without bipartisan cooperation in both houses of Congress.
The bill provides $4.8 billion for the National Institute of Health to pursue a moonshot to cure cancer, investigate brain chemistry, and develop individualized or precision medicine. $1 billion in state grants will be used to address the opioid crisis in the first 2 years to supplement opioid abuse prevention and treatment activities. And this final one, take a look at this, perhaps the most controversial, $500 million for FDA drug approval. Now, this will be used to detect cancer earlier, but also to accelerate drug approval. This may sound good on paper, but critics say speeding up FDA approval is dangerous and sends a wrong message. Massachusetts Senator Elizabeth Warren railed against the legislation that would ease standards for new drugs and medical devices, saying the bill had been hijacked by the pharmaceutical industry.
I've been taking a look at the details here, and when the American voters say that Congress is owned by big companies, this bill is exactly what they're talking about. So now we face a choice. Will this Congress say, yes, we're bought and paid for, or will we stand up and work for the American people?
And Warren isn't the only one calling out this bill. Consumer groups like the National Center for Health Research say the measure would unacceptably lower safety standards at the FDA. And watchdog group Public Citizen argues the law gives too much leeway to pharmaceutical and medical device makers. Dr. Michael Karomi is the director of the organization's health research group. He says it is sorely disappointing that Congress gave big pharma and the medical device industry an early Christmas present by passing the 21st Century Cures Act. He goes on to say this gift, which 1,300 lobbyists, mostly from pharmaceutical companies, help sell, comes at the expense of patient safety by undermining requirements for ensuring safe and effective medications and medical devices. Big Pharma brings in an estimated $325 billion in the U.S. Medical device companies make about $150 billion. Under this new bill, they'll make even more as new drugs and devices are ushered into the market.